and
Well,
putting
there's
it?
you can take, there are two basic types, and one is called autologous, which means you're going to take the patient's own cells and give it back to them. Maybe take it from a compartment where they can't operate and put it into a compartment where they can. That's called autologous stem cells. And that's exciting, and that's probably going to be the most widely accepted, and that will happen the quickest. But following that, we really have to get to allogeneic adult stem cells that we take from placentas and cord blood, because they're young and robust. They multiply 50 times faster. They put out 50 times as many biochemicals that heal with these trophic effects.
So what you're saying basically is, in the future.
Well, we've done it now.
But on the practical sense,
Right.
in the future,
Yes.
when someone is pregnant, they can take that from the placenta,
Right.
and
Freeze
like and freeze it.
Oh, yeah. The
So-
problem is, the thing is that what people don't, another thing that people don't understand about adult stem cells is that those stem cells from babies, placentas, and umbilical cord are universal donor cells. There's no need to freeze them and take care of them for all those years for your family, for a child that's going to maybe grow up and need them 30, 40,
Right.
50 years later. Just start using those now, because they're universal donor. And just like blood that you put aside for if in the hospital,
right.
just give it, you donate your blood, and then you get a card that says someone should donate it to you when you need it.
Right.
And don't have to freeze it and keep the records and all that.
Are you talking lifelong therapy, or?
No, usually once the disease process is dealt with stem cells,
Right.
there's often no need for further. For example, autism. Autism, we know it's controversial, of course, but we know there is always decreased blood flow in the temporal lobes and some loss of brain cells. And once you replace those, you're done.
You're done.
We had a 9-year-old autistic girl that was so profoundly autistic, she didn't say a word. She couldn't utter a word. She could only grunt. 4 months after a simple IV of some baby's stem cells, that a baby that wasn't using them anymore, left them behind in their placenta, and they went home with mommy. Those cells, this young girl was talking a blue streak. She went up in grades in her at school. I mean, this is all well documented.
So where was that done? In the
Costa
United
Rica.
States? Costa Rica.
It's illegal.
It's illegal in the United States.
Entirely illegal to do that here. We are not even allowed by the FDA to take a patient's own cells and use them to help them when they get sick. It really is an abomination, which is why I wrote the book.
Cells That Heal Us from Cradle to Grave. And the book is available at
Amazon.com.
Amazon.com.
Ebook
Where do you
and-
see the practical? How far down the road? And we're 70-something on the list.
Look, and this is why it connects to current politics, Medicare, Medicaid. It's the only thing I see coming down the pike that could possibly decrease the cost of medical care. For example, we had a patient that had non-ischemic myocardiopathy, which is a condition that had killed his mother and his sister.
And what is it?
It's a heart disease, and your heart keeps pumping less and less effectively until you die. And we can measure the effectiveness of the heart pumping action by what's called the ejection fraction. And normally it's about 55%. And it'll go to 40%, to 30%, to 20%, 10%, a little bit lower, and you die. And this happened to his mother and his sister. His was already 30%. And he came to us, and we treated him, and he was told by his team of physicians, and quite rightly, that the only treatment was a heart transplant, which is about, I don't know, $250,000 if you can find a donor, and if you can find someone to pay for it. And we treated him for $15,000. and he's completely back. This was published, okay? Ejection fraction of 55%. All his cardiac enzymes have gone from very abnormal to totally normal now, and he's exercising vigorously. So we traded $250,000 for $15,000, and that's how stem cells can solve the healthcare cost crisis.
And that was done where?
This one was in Costa Rica,
So,
which has been closed, incidentally, because it got attacked politically, simply because there is, you can have, I theorize in my book why there is such a negative reaction to adult stem cell therapeutics.
and that is?
In the beginning, they used to confuse it with embryonic stem cell therapeutics, and there's an audience that hates that automatically. And that was the right wing of things, the
Sure.
conservative right wing.
Sure.
And they started a fight, as you know, with the liberals, who are very much for stem cells. They didn't call it embryonic, but that's what they were for, embryonic, which you have to kill an embryo to get. So now they had this loud fight, and the people who are for embryonic stem cells, which is pretty much all the scientists, because of funding and whatnot, but they're all for it. You'll hear over and over again, I see it written all the time, it's the embryonic stem cells that will bring the vast improvements to medicine. And I'm saying in my book, and I'm saying quite clearly, I disagree with that entirely.
Sure.
I think it's a dangerous, dangerous, wrong-minded thing.
Well, you've already given 2 examples of why
Exactly,
adult stem cells
and there are many, many more.
are
And
the
it's usable
shortcut
and safe
and
right now.
safe, sensible, immediate,
right.
low cost,
That's right.
and will be low cost in the future. I find this.
Will get lower all the time as we learn. But doctors have to focus on it, and they don't. They don't even know about it. As sad as that is, when I talk to doctors, and incidentally, I'm a diagnostician, so I talk to doctors for a living. You know what I'm saying?
Sure.
Usually, patients come to me because doctors have sent them, and I report back to the other doctors. So I'm talking to doctors all the time. I know what they know. And I know what they don't know, and they don't know anything about this.
But there are so many doctors across the country. It's like there are so many accountants across the country. You can go to a good accountant that keeps up to date on all the tax laws, and you can go to another
yeah.
good accountant
Yeah.
that maybe isn't taking the extra step
Honestly,
to find out
Sally,
about.
honestly,
They don't know about it.
these are good doctors that don't
But
know
don't
about it.
know about it.
They're good doctors that don't know
Right.
about it. It's our system that hasn't brought this information to them. Once
And
they
what a
get
shame.
it, they're going to absolutely.
Right.
I've never met a doctor that didn't love the stem cell arena once they knew it was there and what it was
Sure.
really all about. I mean, we all get it. Look how exciting this is.
It
We
is.
found a
It's
healing system that
very-
we can augment.
It's very exciting. It's very exciting. And I think once your book gets out there to the masses, and doctors read it, and patients read it,
Only my
and
uncle
talk
Lou
to
Nocera has read it so far.
Well, I'm going to read it. I'm going to read it. Lou's sitting over there he's being so good today. Well, we're down to the end of the show. Could I say that they can get the book at the tea room?
Oh, I would love
that
to have
this
it.
might be available
Sure,
locally?
absolutely.
And the cost of the book is?
The e-book is about almost $10. That's almost $20.
Okay, so they can go online and get the ebook
they can get
version?
both.
Or they can get this book locally for $19.95 or
Yes,
whatever?
exactly.
And will you provide us with some autographed copies?
I'd love to.
All right, so let's arrange that so folks here can get it locally. We'll see if we can get it at a couple of the
And I
Moody
put an
Street bookstores.
instruction in
and-
the book. Please, after you read it, give the copy to your doctor.
That would be, amazing. A great suggestion, fascinating field that's right before us.